Now to the so-called tripledemic threat and fears it could get even worse following the holiday weekend. More than 3/4 of the nation's pediatric beds are now filled, and urgent care centers are seeing a crush of patients. Trevor Alt is at a children's hospital right here in New York with more. Trevor, good morning.
Good morning. What officials here at Mount Sinai Children's Hospital say they've already been facing high levels of patients in the emergency department. And with COVID, we have seen repeatedly how holiday gatherings can really accelerate the spread of sickness. We could now be seeing that happening on 3 separate fronts.
This morning, health officials fearing the holidays may worsen the tripledemic surge of COVID, flu, and RSV, as some hospitals and urgent cares are already facing a crush of patients.
Our book-ahead slots absolutely fill up.
Data from HHS shows nationally pediatric bed occupancy remains the highest it's been in the last 2 years, with 78% of beds filled. Long Island 3-year-old Ella Rose was in the ICU on oxygen with RSV for nearly a week.
It was horrendous. I hope no parent has to go through it. It was terrifying.
And the RSV threat is playing out amidst an earlier and more severe start to the flu season. The hospitalization rate the highest for this time in the season in more than a decade, and some experts warn this may just be the beginning.
We just had massive gatherings, the busiest travel days in years, and a large amount of circulating viruses all over the country.
This comes as new concerns that common flu medications like Tamiflu are in high demand.
We are definitely seeing shortages in some areas of supplies of common antibiotics like amoxicillin, which is the first-line medication, as well as Tamiflu and some other medicines as well.
Johnson & Johnson, which makes brand-name children's Tylenol, says there's been high demand, but, quote, we are not experiencing an overall shortage.
And several senators are now calling for immediate action to try to resolve that shortage of oral amoxicillin. Doctors are stressing you should call your pediatrician if your child is ill. ER visits are for the most serious adverse symptoms like shortness of breath. Amy.
All right, Trevor, thank you for that.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.